Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, we are super excited to have you here. Welcome. We're having some just incredible conversations with real leaders that are really painstakingly reshaping the future of healthcare. And we're very focused and passionate about a few different areas. We're passionate about healthcare innovation, about leadership, about the adoption of that innovation, and access. So if it's your first time tuning in, let me just sort of peel back some layers of the onion here and just kind of give you a little bit more detail about what we're trying to get done here. So our focus is bringing real stories of innovation to life, not just stuff that you read in a book or read in an article. Like these are real things that are happening in the real world, real learnings that are happening, and giving these folks the opportunity to share their story with our community and ultimately with the world. So wherever you are, if you're watching this, if you're listening to this, please hit the subscribe button now so that any new interviews come directly to you. So, look, most people they talk about innovation. Very few people have made it work inside of a real health system. And this is why today's conversation really matters. So, on the show, I'm joined by Justin Brueck. Justin is the System VP of Innovation and Research at Endeavor Health. But what matters more than his title and how he is really sort of how he got there. It's a really interesting story. So he didn't show up with a big idea and a big slide deck. He started as a fellow. He learned the system from the inside, how decisions get made, where things slow down, and why good ideas often stall out. So today, he helps lead work across genomics, research, simulation, and innovation. I'm probably missing a few things, Justin, but you'll fill that in just in a moment. But he's not here just sort of chasing shiny objects. He's focusing on what actually helps doctors, clinicians, and patients, you know, do their things and jobs better. So interestingly enough, Justin grew up in a small town in rural Iowa. We'll kind of bring why that matters in this. I think his background shapes sort of how he thinks and how he processes and makes decisions. He cares about access, he cares about practicality, and he cares about whether something works when resources are tight and the stakes are high. So, in today's conversation, we're going to talk about what innovation really looks like once the door closes and the work begins, where it breaks, where it surprises him, and what it truly takes to earn trust inside of a larger health system. So, Justin, great to see you. Welcome to the show.
Thanks, Michael. And I think we should just end now because you've said so much great stuff. I don't want to ruin it.
Well, we are recording this. It is your episode, so you could just, loop it and play it to your
That's
kids
perfect.
and your, you know what I
And
mean?
there's
So you'll kind of, that'll be your entrance song, kind of like, the Chicago
my
Bulls when they have a
walk-on
theme
music.
song.
I love it.
Yeah, that'll be your walkout music. All right. So before we kind of dive in, I'm just thinking, take me to a random Thursday from the last month. Where were you? Who were you with? And what problem were you actually dealing with?
So if in the last month, I think Christmas fell on a Thursday, and I have six kids, so I will tell you, trying to keep them ordered relative to who gets the present first. That actually was a real, but I will tell you, there's something really refreshing when your kids start to realize that they get to presents faster if they get along. So I'll take
Mm.
that as a win. A normal day for me at Endeavor, it's partly because of the unique nature of my role and the fact that I kind of can jump from different things. So I may start my day, at Evanston Hospital working on things with some physicians around research ideas, or even meeting with our sim lab team to try to understand like what are they working
Yeah.
on. Um, I start at the Research Institute, where we have a very large team that's kind of helping us administer research. But also we have our wet labs there, so I get a chance to actually interact with the scientists, which is phenomenal when you're actually trying to think about bridging the discovery from bench to bedside. On the innovation side, you could be having conversations with startups, with founders, with venture
Yeah.
groups, just trying to figure out like where we're at. But my favorite thing to do is to talk to the clinicians and the frontline staff, because that's really where you start to hear like what are the true pain points that they have. And I think as we talk through this interview and conversation, a lot of the things that I'm going to reiterate are we have to be focused on solving today's problems. And if you're not focused on solving today's problems, you're never going to build the trust that's going to give you the ability to jump 2 to 3 years out in advance because
Yeah.
people need to have that confidence that you're there to support them and you're not here just to try to, bring the new AI tool in that's going to take something from them.
Yeah. I mean, when you first stepped into this role, um, what did you underestimate?
But I'll say that I probably underestimated the amount of time that it takes to move things through a system.
Mm,
Um, and I think that's an important thing for startups. I think it's for anybody that's working with health systems to realize it's not that we don't want to move quickly. It's just that there are a lot of priorities going on at any given moment, and you have to be able to flex with those priorities and recognizing that you may have the greatest idea ever.
yeah.
But if you don't have other people that are aligned with you, it's going to be, moved down the priority list. And I will say that I have worked with several companies that came in, hotshot CEO said, we're going to get this thing through in 2 weeks and, let's get it done. And
Yeah.
they find out very quickly, 6 months later, that you have your first red lines.
Yeah. Yeah.
I think that would be my
And
biggest
six
learning
months
is
is
just
fast, by the way. 6 months is fast. I was thinking like two
we
years
we,
later.
we have we set high goals. But yeah, I mean, I think that's a major one for me. But I also think it's the number of players that have to be engaged to move an innovation along. We started out with something that we were looking at with remote cardiac rehab at one point in time, and we thought we'll get some cardiologists, we'll get IT, and we'll turn it on. Well, pretty soon you realize you have to have the credentialing team, you have to have rev cycle, you have to have legal involved, of course, and you have to have quality so that they're double checking and make sure that the quality outcomes are comparable. And
Yeah.
then you have to have the finance team there that's validating all these things along the way. And so it takes a village to really make this stuff happen. So not for the weak of heart, but I think once you start to understand those and you kind of get that process in play, it creates a flywheel effect that allows you to move forward. We're not perfect, first to tell you, but I think we've got a good process in play, and are looking forward to the next couple of years as we become this one large system, spreading innovation across all corners.
Well, before we kind of dig even further, I'm just because I love your origin story. I think it's phenomenal. Like you didn't one day just wake up thinking like, "Hey, I'm going to be this innovation leader." Like talk about the series of events in terms of how you really stumbled across healthcare and then started really kind of digging in and now you're kind of you are where you are. Obviously, there's a few tours of duty and stops in there in between, but would you mind maybe just sharing a little bit of that? I think it adds a little bit more richness and color.
Yeah, I mean, so if you asked me what I wanted to be when I grew up, I literally said this to my parents. It was either a UPS driver or a pilot. I don't know where those two came from. So I
You look
was
like a
never the one
pilot.
that said,
You look like a
no,
pilot.
I was never the one that said I want to be a doctor. In school, I did fine in school. Was small school though, so I mean, like I was first generation college student. My parents didn't know Ivy League schools. They didn't even think about that, and I don't even know if I would have gotten in. But I did. I was fortunate to get a scholarship from Pella Corporation to go to Central College in Pella, Iowa, and that was my first foray into understanding like what liberal arts education means, because
Mhm.
I had a biology degree, a chemistry minor. But during that time, I also started to get engaged with music. My family has a love of music. My father sang, my mother was a flautist, there you go, flute player. Um, and so we've always had music in our lives, and I played the piano. Fortunately, I had to take an elective in music, and they had a very beautiful pipe organ. And I said I'd love to learn more about pipe organ and things like that. And a professor by the name of Mark Babcock decided to take me on, even though he had no obligation to, and probably
Right.
wishes he wouldn't have at some point in time. But the long and short of it is, through that, I ended up graduating, not knowing what I wanted to do, and that was okay. I ended up somehow getting a music degree after healthcare, or after my biochem degree. And there was a journey through there of thinking about being a priest and sacred music. And so it all makes sense, right? No, it doesn't make any sense. And I think that's part of the moral of the story here. Um, but long and short is I got into healthcare because I had people who gave me an opportunity. And I think that's really my story. And I think that's something that it's the pay it forward to others. Um, So again, I graduate with my master's degree in music. I'm like, what am I going to do? I'm working at a bank as a part-time bank teller. I'm playing at church on the weekend. Like, how did I get to this point? There was a guy that came into the bank, and I got to know him, and because he also went to the church that I was playing at, and he said, "What are you doing with your life? What do you want to do?" And I was like, "I don't know." He's like, "Come to my office." So me being, naive, I'm like, "Sure, why not?" Lo and behold, he was one of the executives at University of Iowa hospitals and clinics. And that chance encounter and that relationship that we developed, he said, "Come to my office." We sat there, we talked. He walked me to the grad admissions person for my MHA program and said, "I'll vouch for him. Let's go." And from there, he helped me, with fellowships. He helped secure my internship in Japan. I mean, like all these things from this one person. Um, and then I got here, and I think this is just one of those stories where,
Do you ever like ask them like why did you do that? Like
what's
to do that for
interesting.
others? I mean,
So this is a fascinating thing about this individual. He has actually done this for others, and he has
incredible.
kind of plucked people from what I would say obscurity, and has really developed an eye for how to do that well. I personally, I would have never picked me at the time, given what I was doing and saying, "Oh yeah, you're right for healthcare." But I think that's kind of what Fast Forward brings a unique vantage point because I am a little bit more Renaissance potentially. As you said, like chasing shiny objects. I think I use the expression ADOS, like 80 ooh shiny. And I think that works for me because I have the ability to look at different things and try to create those connections. But at the end of the day, my story is because someone gave me a chance, right? And I think you have that
That's
ability to pay it
access.
forward, and I look forward to doing it to others. I actually mentor different groups, working here in Chicago with startups, and I think sometimes it you got to start looking out for others, right? And I think I'm at a point now where I'm excited to do that for the next generation.
That's awesome. Is there, I'm curious, I mean, what's something that you did early on in your career that maybe makes you cringe now, but really helped you grow?
I'll give you two. One is a very
Okay.
practical one that just is like human behavior 101. And the second one is actually one that I still carry with me. So the first one is honestly, I was overseeing an outpatient radiology location, and we had MRs, we had CTs, and we had mammogram, we had standard X-ray.
Yeah.
And it was during the middle of winter. This was early before pandemic. And we had several staff that called out because they were sick. I mean, they work together. Of course, they're going to
Yeah,
potentially
yeah,
spread.
yeah.
Um, and I remember that because an MR that sits empty is significant revenue loss. I went out of my way. I delivered orange juice to this person's house. I was like, come on, man, we need you back. Like, can you get there back by tomorrow? I didn't do it for one of the x-ray techs, and they found out. I
Hmm.
will tell you, they didn't say anything to me for a very long time, but I could tell there was something there. And the lesson in all of that is I think I was looking at it as a revenue play. Like we need to get our MRs running. I wasn't thinking about the people side of it. And I think that was an
Hmm.
eye-opening kind of experience for me that really taught me the importance of making sure that you rise all boats, right? You gotta support the entire team. And the whole expression of like the janitor is just as important to delivering great healthcare as the neurosurgeon, as a CEO. So I think that's an important lesson. The one that I learned a little bit later in my career actually was a result of, um, given my personality, our chief human resource officer actually became my mentor, which just tells you how close to being in trouble I was. Um, but it was a period of time where I was just really excited. I wanted to do all these cool things, and the challenge is I didn't recognize that he said, you're seeing green lights. You're just a guy that's like the eternal optimist. You're just going to see green lights wherever you go. The problem
Yeah.
is you're blowing,
Guilty.
yeah,
Guilty.
exactly. You're blowing through these intersections, and sometimes a green light is actually your signal. And so you have right of way. But he goes, you are running into more red lights and you're just blowing through them. And the problem is, oftentimes people around you are stopping and protecting you, but they're not forgetting about it. And so the life lesson that, and I still have this little squishy like stress stoplight on my desk. It's you got to realize that every time you're encountering a relationship, it is an intersection. And if you blow through it, you may get lucky and not get hit. But the reality is the people that are there on the sides, you've seen them. They honk, they may throw some fingers places, right? But that was the life lesson I think for me that really resonated and still stays with me is that there are intersections throughout your day, and you have to understand that sometimes people need to get, yield the right of way. But you
Mm.
got to make sure that you're not blowing through signals.
That's super fascinating. Along those same lines, right? So there are signals around good ideas, and there's probably no shortage of good ideas that come across your desk. Tell me about a good idea that everyone agreed was smart that still died.
No, I would say that I'll actually use that example with the cardiac rehab.
Yeah,
Here's a situation where I didn't even appreciate what cardiac rehab was when we got started with this, but it is the single most important thing to do after a cardiac event to ensure it doesn't happen again. And it makes
yeah.
total sense. You got to get your heart healthy again. You got to get it where it needs to be. Um, and right now in healthcare, we don't have enough slots to be able to see the number of patients that actually need it. And patients don't necessarily want to do it because let's call it for what it is. You go to a hospital and you work out, and it's
Yeah,
not
yeah.
super nice. It's like the 1970s YMCA title and probably the smell that goes with it. Um, but it's really hard to get patients to do that. Plus, you have to be able to take time off work. And so there was this moment here where it's like nobody can actually do this unless you're a retiree and you really, want to get that next
Right.
opportunity at life. So there was a use case and a problem statement there. And what ultimately happened is we launched this, and the company was very successful in terms of the outcomes, but we couldn't get over the change that it meant for those that were the incumbents. And I don't mean incumbents in a bad way because it was the cardiac rehab teams. They were very committed to doing what they needed to do to take care of patients. And I think as we talk about technology, we talk about all these different things, it's so important that those frontline staff are there from the onset because we
Mm,
were viewed as an outside threat when in fact what we could have been viewed at is we're actually taking the patients that don't necessarily need to be there because they may be less acute. So you
right.
can actually maximize what you have trained your entire life to be able to do.
I mean,
And
oftentimes
so
people say no because, they're trying to protect their turf. Knowing what you know now, would you frame it any differently where it actually could have possibly made it?
um, I still think there's a chance for this, and it comes back to the question of timing. And it's the optimist in me that it'll always survive. And I think in healthcare
Yeah.
we have that problem. Um, if you bring people along from the very beginning and you help them, as my boss says, don't bake a cake and bring it to me and expect me to frost it. You need to be part of the ingredients. You need to have them helping to knead the dough or whatever it is if you really want them to have that shared ownership. And that requires time. And I think
Yeah.
what's the challenge in innovation, and to a fault potentially with even some of these companies, they push so hard because they are so passionate about what they're doing that
Hmm.
sometimes it pushes us, if we're not paying attention, to bypass some of those steps in order to become more efficient. But I
Yeah.
think if you ask several of these companies, and even that company, I think they would have said we would have spent much longer at the beginning doing stakeholder engagement because as opposed to it taking potentially 9 months to launch a pilot, it took
Yeah.
18. It
Yeah.
was 18 that could have been shortchanged by simply making time at the beginning to get more bakers, helping with the cake.
Yeah. Relationships are made or broken in the beginning, not at the end. So that makes a ton of sense. Because you like green lights and you like to say yes, what is the hardest no that you've had to give to a team that cared deeply about something.
So I will say that no is, I always try to be honest and with my teams and say, I want to be a no but kind of person. And it's just again like part of this, there's a way that we will find a way. But yeah, there are times when you have to say no. And I will tell you there are more often times than not where it's a no because it hasn't been framed correctly.
Mm,
And I think that to me becomes one of the clear mistakes that happens with ideas and people bringing ideas forward. They're so focused on the what and the thing that they forget about the why. And
yeah.
so for me, that's the kind of connection point that I'm always looking for is like, so why is it that this founder has come to me with an idea? Is it because they were handpicked by a really great venture firm to say they have a track record of spinning off companies and they're going to do the next one? Or is it because they're a founder that has a personal story, that has a
Mm,
passion behind it? So I would say oftentimes I say no because I don't necessarily see that we have alignment in terms of our interest.
yeah. Yeah. Does it make it more alignment ready when there is a personal story, that level of, not to say that someone who doesn't have a personal story doesn't have conviction, but does it make it more believable? That, I mean, because to me, belief, having that conviction, combining is, to me, it's a superpower. When someone
It
is really
is.
passionate
And
about
again,
something, it's incredible.
you're right on. And would I say that we turn down companies that don't have that the story because I've heard enough of those stories that have been. I think ChatGPT wrote some of them. Um, we're not going to
Wrote
turn them down.
95% of them.
Yeah, yeah. I'm not going to turn them down by default, and I'm not going to accept someone who has a great story if they don't have context. But what I have seen in working with leaders and many of the companies that we have long-standing partnerships with, they are not. They are founder CEOs. And actually, I bet if I looked at our portfolio right now, the majority of things that we have are founder CEOs.
Mm,
Those CEOs often are still actively engaged with the company. And again, that's partly because it's a growing and evolving space with all the new technologies, and no one's had the big exit. But um, there's something to be said about that founder CEO.
Talk about some of the work that you and the team are doing around genomics, because every time I've heard you speak about it, you kind of light up about it. There's a level of pride around it, and I'd be remiss if I didn't ask you to sort of share some of the amazing work that you and the team have been doing.
Yeah, it is. It's a point of pride for me. It's a point of pride for the organization. But I am fortunate to be standing on the shoulders of giants on this one, and I truly mean that. We have been at this for since the 1980s. Henry Lynch of Lynch syndrome was one of our first medical directors. So like we were in it even before we probably knew what we were in.
Mm,
Um, and we have an amazing team. We have pharmacogenomicists. Mark Dunnenberger is a great guy. Peter Hulick, our genetics counselors, Kristen Hughes, all these different individuals that show up every day because they see the potential for us to move genetics from this genomic exceptionalism into something that's actually part of every patient's care. And I think that's what I get really excited about, to be honest with you, is like I don't know one half of my family history because my mother was adopted. And so when you think
mm,
about that and you look at how much of your screening and guidelines are based off of your family history, I don't have one on that side. And so for me, genetics provides this quantitative family history that is not, well, I think Aunt Sue died of, was it colorectal cancer or was it breast
yeah,
cancer,
yeah,
right?
yeah.
It actually gets you the ability to understand quantitatively. As a community-based hospital and a community-based health system, I think we are uniquely positioned to be able to deliver on genomics because the thing about genomics is, yes, it's expensive. Doing whole genome sequencing and all these things are
Right.
not for the weak-hearted, and payers aren't necessarily paying for it. But what we have the ability to do is start thinking holistically and longitudinally about how you use genomics as a test with lifetime value. You go back and query the information based off of what clinical presentation you have or different risk factors that evolve with your age. Genomics is not a crystal ball. Like it doesn't tell you everything, but
Yeah.
it's a really important signal that helps you better understand your destiny and you can do something about it. So, I mean, I think genetics has a tremendous potential. The costs are coming down. We've been now fortunate to sequence over 50,000 patients, or not sequence, we've had 50,000 patients complete some sort of a genetic test. And that is just a drop in the bucket. Our patient geography is 1.4 million and growing. 50,000 is a great testament of what we can do when we put our mind to it. But I want to see a zero on that in the next couple of years. And that's going to
Mm.
take us being able to truly prove out the business case as well as the clinical case so that we get folks to embrace it.
When you think about innovating, you mentioned the business case. How do you frame up some of these ideas and problems that you're trying to solve today? Like you're marrying, hey, we need to solve this problem, but we also need to come up with a business case. Like, walk me through your thinking. What happens internally to the degree that you're actually able to share? Because I'm just going to say this from a founder's perspective, they're just like, well, they only are seeing it from their perspective, but they don't see what needs to happen in the inner workings of an organization that's multifaceted, lots of different priorities that are happening. Give them just a snapshot to see, because it's kind of like you're going through a gauntlet, and there's a lot of things that can get you off course or get you killed. So if you're able to share, would love to hear more of that.
Yeah, I think that as the organization has gotten larger, I'll be honest with you, that the impact is going to have to be greater. And
Definitely.
so the days, and again, we're a $5.5, $6 billion organization. For me to come back and say, I need everybody to get excited and I have the ability to deliver $1 million of value. I hate to say it, but $1 million, while it's a million dollars, it's a rounding.
Yeah.
So for me, it's really, really becoming important for us to not focus only on the dollars and cents, but to really understand the holistic value that you can get out of that. And so we talk a lot about workforce empowerment. We talk about care differentiation. We talk about our institutes. We talk about US News and World Report. Like, how do you start to leverage innovation to be an unlock with multipliers surrounding it?
Mm.
So I would say that we don't anchor specifically to the financials. Of course, it's a critically important one,
Yeah.
particularly if it's going to require a lot of capital or additional resourcing behind it. But it has to be the whole solution in search of a problem. It's got to be a problem that we have, or it's got to be a really unique opportunity that we think we're well positioned to win in. And then we put together kind of the overarching, what is the value prop across multiple dimensions.
Nice. So now you're in this leadership role. Um, your team is quite big. To talk about that and the dynamics of that, because I mean, I want to know that, when now that you've been in leadership, um, maybe what's something about leadership that has kind of surprised you once you've kind of been in it for a bit.
The thing that surprises me is nothing surprises me in leadership. Um, but it's very interesting because you work with different teams, and it's grounding for me because remember, I have the innovation side where it's like go go go, and then I have the research side, which is, well, the regulatory says this and this says this and this and the IRB and all these things. And so it's really interesting to try to sit in the dynamics between that. My meetings that I have with the teams are vastly different. One of them is called like the research cabinet. The other one is like the innovation collab, right? And these
Mm.
kind of things. I mean, those just dynamics you have to understand and appreciate. I try to bring some fun stuff over to the research team, and I think they're coming along for the journey. But I think in leadership, it's relationships, it's recognizing that uh, when it's you I've had several experiences actually this year where the most important points that I've reflected on are when it gets tough, do you still show up? And are you there for your teams? Because that matters more than you can ever imagine when it comes to retention, relationships. They are the most important thing. So um, we're a people business, and that is our biggest asset that we have. And so we have
Definitely.
to nurture it.
I'd be remiss if I didn't ask, well, I mean, what is the best way for people to follow your work, the work of the teams that you get to guide, that you get to lead? How do people follow Endeavor Health and all the awesome things that you and the teams are doing?
I mean, I think you said like hit subscribe or something, and I'll come back and we'll talk
I
about
told them to
it.
hit subscribe, but we want to
Yeah,
put
yeah.
it, but I'll give you
Yeah, I mean,
the mic to
I
do the commercial.
so we are actually in the process of developing a pretty robust intake process, and I'm happy to include
Yeah.
in follow up to this a link to our intake process so that people can share ideas with us, and that's really I think a way for us to begin understanding what are the different ideas that really make sense for us. We're very clear up front in the intake process, like these are the things that are our number one, two, three, and four priorities. So definitely there, and then. LinkedIn is pretty phenomenal. I haven't gotten onto X or any of those things yet. My wife actually got me off of Facebook like 10 years ago, which now looking back and like greatest decision that she ever did is, keeping me off that.
Smart
But
woman.
yeah, follow that. And honestly, I think in the coming years, you're going to see Endeavor really double down on promoting innovation because in such a competitive geography, both for talent but also for patients, you have to be
Yes.
able to demonstrate that what you're doing is actually providing differentiated care. And I do look at healthcare, it's pretty much the more things change, the more they stay the same. I think we need to be able to break that mold, and I'm hoping that given this new system coming together, unified medical group, single Epic platform, once we get something figured out, we can scale it immediately. Hopefully, you'll see us in the headlines for good reasons.
As I say, for good reasons, right? All right, let's do a little quick fire before we wrap. I'm gonna ask these quickly, no follow-ups, just tell me what you think. A meeting that you always prepare for.
One on one,
Hmm. Something that looks easy from the outside, but isn't.
revenue cycle,
Hmm. Most overrated idea in healthcare innovation.
agents, right
Hmm.
now.
Hmm. What about most underrated constraint?
Underrated constraint. This is like a double negative I have to work through. So the underrated constraint, bandwidth.
Hmm. What about one thing that you would not fund right now?
Huge AI project
Hmm.
with without very clearly understanding the value prop
Okay. What about a habit that you protect?
with my kids.
Um, what about a habit you're trying to break?
Scheduling back-to-back meetings that have now become 30-minute meetings because we couldn't get them in.
All right, and last question. I mean, if someone listened to this conversation 5 years from now, what would you hope that they feel?
At, at the end of the day, healthcare is it's a people business. It's
Yeah.
people we care for, it's people we work with. Relationships matter. And more than anything, technology is going to bring some amazing things. But at the end, as we talk to our nurses about virtual nursing and all these things, they want less noise, less toys. They want to be able to bring joy back to the bedside. And as opposed to having a computer screen blocking their view to the patient, they want to be able to sit on the side of the patient's bed and talk to them.
This has been awesome, Justin. I appreciate just your you just have a good sense of humor, good energy. You clearly have you want to do the right thing. You want to make things better, which is why my gut was like you'd be a great guest for the show. And
Well,
I'd say that
you're
my
very
instincts served me
kind,
right.
and I will say that this is not something that is come together overnight, and it's still a work in progress, as we all
Yeah,
are.
yeah, yeah. But even something that you said about, hey, someone gave you an opportunity. So I would say if you're listening and you're in a position where you can grant someone access, give it, because it might just be something that could change the trajectory of someone's future. And Justin, in your case, it sounds like that was the case. Like you might not
Absolutely.
be here had you not been able to jam out the organ. And that gave you the opportunity to meet someone at their office and they poured into you. So that to me is there's forms of innovation that happen because of a series of events. But you were in the building and you put yourself out there and you poured yourself into that. So that just showcased something. And like you mentioned, the human side of leadership about change and adapting to that change, all that matters. So um, for those that are listening, thank you. And if there is a topic that you want us to explore, or maybe even a leader that you want to hear from, drop me a note, leave a comment. We do read them. And if you really love this episode, would you mind sharing it? Like, let someone that is in your network, let them know about it. So this is a platform that is absolutely about authentic community. So thanks for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show. Thanks for joining,
Michael.
Justin.
Thanks, Michael.